My name is Gustavo Guajardo Salinas. I am a cardiovascular and thoracic surgeon. I work here in the Thoracic Institute of Texas, cardiovascular and thoracic surgery. My background, I was born and raised in Mexico. I went to medical school in Monterrey Tech, and once I realized I wanted to be a surgeon, I came to San Antonio, where I trained at the University of Texas and became a general surgeon. Then I went to Houston, Texas, and became a heart surgeon, and I practiced thoracic surgery as well. I trained at the University of Texas MD Anderson Cancer Center. My specialty involves anything inside the chest, basically chest surgery, whether it's lung cancer or whether it's heart disease, like coronary disease, aneurysms, or valvular heart disease. Really have a passion for the anatomy inside the chest. To me, it's very interesting, the blood vessels and the function of the heart and the lungs. Rewarding to be able to fix somebody's heart or treat somebody's lung cancer. It gives you a very good feeling to help people that way. I've been a heart surgeon or a cardiothoracic surgeon for the last 5 years. I didn't practice in the state of Texas, but my family and as well, and knowing Dr. Lee is what led me to come back to San Antonio and practice for the Institute. Mostly are patients with heart disease, patients that have blockages in their coronary arteries, patients that have heart attacks, patients that have aortic emergencies or aortic aneurysms, as well as patients with lung cancer. Basically, it's any surgery that goes inside the thoracic cavity or the chest. So anybody that needs heart surgery or surgery in the aorta, you can see in the pictures. Anybody that needs replacement of the ascending aorta, or anybody that has lung cancer and needs surgery, that's the definition of cardiothoracic surgery. As we specialize in treating valve disease, in the last few years, the surgical field and the cardiovascular field has advanced towards the more endovascular or minimally invasive treatments. The transcatheter aortic valve replacement, or TAVR, is one of the ways we can fix aortic stenosis, which is a blockage of the aortic valve. And we can do that through a catheter, through an artery, either through the groin or other small incisions. I have many patients' success stories. There's a few that you will never forget. When I got called for an emergency of somebody dying that we're having a hard time finding a blood pressure, and he had an ascending aorta that was dissected, and the patient was very ill, and we had to take him to the OR emergency, and it was a long surgery. But luckily the patient recovered very well and was able to go home, and he's back to work, and that just makes me feel very happy for him. So if you or a family member has heart disease or valvular problems or aneurysms of the aorta, as well as any problems with your lungs, like lung cancer, please feel free to visit our website, talk to your doctors. We're happy to take care of you. Remember that it's our passion to care for you and improve your quality of life.